I see a lot of patients back as part of my routine follow-up of them for their treatment of their breast cancer. Typically, I see patients twice a year, roughly every 6 months, and I always want to see them when they're back for their annual mammograms. Now, obviously, as I'm following patients over a long period of time, there are going to be patients of mine who are going to progress on to stage 4 breast cancer. Stage 4 breast cancer is unfortunately not curable. However, that doesn't mean that it isn't treatable. And so from my perspective as a surgeon, what are the goals here? What do I want to see happen to my patients who have now progressed on to stage 4? Well, clearly I'm going to be working with my team. I'm going to be working with my medical oncologist and my radiation therapist. It depends at what point and where they are. What is the definition of stage 4? Is it spread to the bone? Is it spread to lungs, liver, brain? And so our goals clearly are to deal with the specifics of the progression of a cancer on to stage 4. So the goal here is to slow the process down. This is not a process that I consider to be completely hopeless and we ought to throw the towel in on, because I will share with you, I've had many patients over the years who have had quite stable stage 4 disease. Typically, this is stage 4 disease that's limited, let's say as an example, to a thoracic spine, one spot, or to a pelvis, or things of that sort. And the medical oncologists know exactly what they're doing as far as the needed anti-estrogen therapy or drugs like Zometa or the other things they can do. Now, part of our goal in the treatment of stage 4 breast cancer is clearly to relieve pain and to relieve symptoms that affect quality of life, obviously, or life-threatening for that matter. So radiation therapy may be needed to isolated areas of bony metastases. A single metastasis to the brain surgically is typically removed, followed by either focused or whole brain radiation therapy. There are instances where we have a single metastasis to the liver that can be treated by an ablative therapy. So the circumstances are highly variable. The goal here is always pain relief. The goal is to get the stage 4 disease under control. The goal is to try and make it a chronic state. One of the things that I envision in the future and now in the treatment of breast cancer is if we go to stage 4, that we put the patient into the chronic disease state like we do with diabetes or other diseases, so that things can be followed over longer periods of time. We obviously want to maximize what we know today, because who knows what's down the road in the future treatment of situations of stage 4 breast cancer. So the bottom line is here, please be working with your multidisciplinary team. Please be asking questions about, are there new protocols out? Please be asking for the state-of-the-art treatment as we know it today. But hang in there. New things are coming. Let us work together on the treatment of your stage 4 disease. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.